an ICU nurse that struggles with time management, this is how I break up my shift to make sure I get everything done on time. And before someone comes at me, yes, I know not every day is like this. It's not always like this. Things come up, things change. We have to pivot, we have to navigate. But in general, this is the ideal flow of my day. My first hour is getting report, doing that initial assessment with the offgoing nurse, doing a basic chart review, my safety checks like checking the monitor, make sure that my patient's bed alarm is on, none of my drips are going to run out, and just kind of doing like a little general tidy up of the rooms. And then we get into our morning med pass, my turns, my cares, and anything that needs to be done on the patient. Maybe they need a blood sugar check, maybe they need some labs, maybe their central line dressing needs changed, getting all of the basic things done to set me up for success. I'm wrapped up with that. I usually sit down and try to chart and get all of that morning stuff charted that if I haven't charted anything already. The next 2 hours of my day consist of doing a focused assessment because we do Q2-hour assessments in my ICU now, doing our morning rounds. And typically, this is when the doctors are rounding, so I'm getting new orders and things, and also turning my patients if they need turned. From noon to 2, this is when I do my next big afternoon assessment, turn my patient, again, any cares like oral care, anything like that, and also getting my charting done. Now, once I get my bulk of my morning charting done, I can duplicate a lot of my charting for the rest of my day. And so it's not as difficult. It doesn't take as much time to sit down and chart when I can duplicate and just modify things. The next part of my day, usually I will take a lunch break somewhere in there. I will do my next focus assessment, turn my patient. Oh, look at, I put turns twice. I'm just emphasizing how important it is to turn your patient. From 1600 to 1800, I will do my next evening assessment, turns, cares, again, if there's any meds, labs, blood sugar check, I will get all that done. A final hour of my day consists of turning my patients one last time, doing one last little focused assessment, finishing up my charting and reviewing it. Yes, I like to go through and kind of do a brief glance of all of my charting to make sure I didn't accidentally mess something up or miss something. I will empty my patient's Foley's and the trashes in the room, update the report sheet for the next nurse, and just tidy things up to make sure that, hey, I'm handing you off this patient, this situation. I'm going to try and set up the next nurse for success. That is a very simple way of how I break up my day. Obviously, yes, sometimes you got to take your patient to a stat CT. Sometimes you have Q1-hour checks. So if you want to see like maybe a more critical patient scenario of how I break up my time, let me know.